Hello, I'm Dr. Arshnoor from Dr. Arshnoor's OET Institute. In the series of the role plays, today's role plays for the nurses and the colleague. Here the patient has come to you who is 62 years old and has rheumatoid arthritis, and you want to get information regarding PPV vaccination. Now let's start. I'll explain the things in the video. Before I start with the video, if you have not subscribed my channel yet, subscribe it right now, because you will be getting a notification on my YouTube channel as I'm uploading a new video every day, and this is going to help you a lot. I started a series of the role plays, and very soon I'm going to start the series of the writings for the nurses and the doctors also. So secondly, if you like my videos, do not forget to like and share these videos with your friends and colleagues. Now, let's start with this video. So this is the 62 years old patient and who is suffering from rheumatoid arthritis. And he has come with a query to you that his doctor has asked him to undergo this vaccine, but he is unaware and he is a bit scared why this vaccine is asked him to get. Now, how you have to start that? First of all, start with the introductory part. Good morning or hello, I am so and so. Let it be your name, Monica or something like that. I am your attending nurse today, or I am the in charge in this suburban clinic. How may I help you? He'll say that my doctor has advised me to get a vaccine that is PPV, and I'm not aware about what it is and why it is required. Then you have to start the conversation by asking his name. How would you like to be addressed? Then he'll say that my name is Johns. Then you should say that fine, Johns. Do you have any medical condition? Then he'll say that yes, I am suffering from rheumatoid arthritis. Then you should ask that from for how long have you been suffering? It may say that 5 years, 6 years, or maybe 3 to 4 years. Then you should ask him that do you have any other problem? Then he may tell that my hypertension or something like that. Now, this is your role play. You have to actively participate here. And as a patient has come to you for the information regarding PPV, then you have to tell. Yes, Mr. Johns, I've got this information from the doctor that he has advised you to take this shot of PPV, that is pneumococcal polysaccharide vaccination. Actually, this vaccination is to prevent you from serious problems, that is pneumonia and septicemia. Actually, the patient who are suffering from rheumatoid arthritis, they are prone to these diseases, and their immune system is low, immunity is low. That's the reason they catch these problems very easily. To avoid that, pneumococcal polysaccharide vaccination is mandatory for you. So that's the doctor has told you. Then the patient will ask the next question that as we take flu vaccines every year, and do I need to take this vaccine again every year? And then we have to answer, no, Mr. Johns, it will be for 3 years. As it is the bacterial infections, and in this case, these remain the same the 3 years. There is no need to get this vaccine every year. It will be repeated after 3 years. In case of flu vaccine, as these are the viral infections and the strains, they consistently change or continuously change every year. So that's the reason these vaccines are required after every year. But in case of the bacterial infections, these are not required. So in your case, this vaccination can be given after 3 years. And what is more important to be seen in this case, that first of all, you might have it's like a slight fever or redness or the swelling at the injection site, but it is not to be ignored. If you find it in the cigarette fever, and if you have more redness, or there you find any a type of wound, in that case you can immediately get the advice of your GP, or you can contact your GP or us at the emergency number, because this is a condition that is to be taken into account immediately, and we'll provide you the treatment for that. But if you find mild fever, or body aches, or some rashes, these are minor. So in that case, it could be ignored, because these are quite common symptoms in case of this vaccination. Now, ask about ask the patient about any reaction to the flu vaccine, high temperature. Yes, did you take any flu vaccine earlier? Patient may say, I usually take corona vaccine, or COVID. At the time of the COVID, I've taken these vaccines. And you should ask, did you have any type of serious symptoms at the time, like high grade fever, or muscle aches, or fatigue? Patient says, no, there's a minor, some rashes were there, and I had discomfort, or mild pain in my body. Then you can say that this is quite common, and every vaccine that gives some side effects afterwards, and it is not to be taken into serious account. It could be ignored. Then reassure the patient about having PPV today. Example, no adverse reaction to the flu vaccine, suitable interval since earlier vaccine. Yes, you should ask that when did you take your last shot of the COVID vaccine or any flu vaccine. The patient may say that I took it last month. Then if the patient asks you that when can I take this vaccine now, PPV, then you should say that it is quite long interval, that 1 month is quite sufficient for the next shot or the next vaccine to be given. So it is right time that you should get it right now. You need not to come to us again, and it is highly recommended. So do not ignore it, and I'll give you the shot right now. So if you're ready, so may I start with the procedure? The patient will say, yes, you can start with this. Then you should thank the patient or appreciate him. I really appreciate, Johns, that you took immediate step for by coming to the clinic and getting this vaccination at this time. So in this way, you may end up the task, because the thanking the patient will be the last step here. Hope this video will be helpful for you. If you like my video, do not forget to share and like the press button, because it will motivate me to make more videos. And if you have not subscribed my channel, subscribe it right now. And one thing more, students, I'm giving individual classes also. If someone requires any classes for OET, then you can comment to me in the comment box. Otherwise, my phone number is also given there. So you can contact me at this phone number also. Thanks for watching. Stay connected. Happy learning. Wish you all the best for your exam. See you very soon with a new video. Till then, bye-bye.